everyone, we're here at our office today with the beautiful Isabel. I know you guys have seen her beautiful makeup looks on Instagram and on other social medias like YouTube. She is self-taught and she is amazing, and we're so lucky to have her as one of our patients. She came to us about a year ago when she was here for the eye mats, and we did some procedures on her. She was really happy with her results, and she came back to us because she now trusts us with her face. We did a non-surgical nose augmentation with Juvederm Voluma XC to help with a small bump that she had on the bridge of the nose. We also did Juvederm Voluma under her eyes for under-eye hollowness and dark circles. We also treated her nasal labial folds, also known as smile lines, with Juvederm Ultra plus XC. We also did a full upper facial of Botox. We did the entire forehead, glabella, we did a brow lift, and we treated around the eyes for crow's feet. We also treated her chin for chin dimpling. Now the time that you've all been waiting for, we're going to answer some questions regarding Isabel's procedures. So here we go.
So I had some of you question me, well us, some questions about procedures that go down in California Cosmetics. And are you ready for these? There's a lot of questions.
Ooh, I'm scared. I hope so.
Alright, first question is, do lip fillers hurt?
Do lip fillers hurt? I would say no. Here we provide actually an injection that numbs the entire area, similar to the one you get at the dentist. So most of the time my patients say they don't even feel me touching them.
Yeah.
Pretty cool.
I've seen follow their snap because they have the whole procedure there. Alright, ready. Another one about fillers. Lip fillers.
Right, yes.
It says, what's the process of getting plump lips? How long does it last? And what's the downtime?
Cool. So we have you come in and we basically assess your lips and we kind of get a feel for what your lip goals are. From there, then we give you an idea of how many syringes you would need. A lot of times we do one in one sitting. So after we do the numbing, we do the injections. We like to use Juvederm Ultra plus XC. That product gives a lot of volume and it looks really natural. Downtime varies from patient to patient. Some people bruise, some people don't bruise. But if you do bruise, it can last up to 7 days. Swelling is usually about 3 to 4 days, and fourth day being the least, obviously. There's ways to get around the downtime. If you avoid alcohol 72 hours prior to your procedure, taking arnica orally really helps with just the overall healing process. So we want to make sure all of our patients are very clear that our lip augmentations are very invasive, so there is downtime, but it's well worth it.
And if you're into makeup, you could definitely cover them up. It's not that hard to cover up. Right?
And you can actually go to her page. She did a whole video on how to conceal bruising, and it actually went viral because people love that. It's so real. I mean, if you have bruising, let's be honest, how can we cover it?
Color correcting and a good foundation. That next question is, what type of person would get under eye fillers?
That's a good question. I get that question a lot from people because there's all types of problems with under eyes. We see hollowness, we see bags, we see darkness, all things that we all try to conceal with makeup, but it doesn't always work. So, we need to basically put volume back in that area with a dermal filler. So if you are experiencing any of those three things I mentioned, you're definitely a candidate for under eye filler.
Like me.
Yeah. How did you like it when you had it?
I loved it. That's why I'm back here, guys, because you definitely see a difference if you're a makeup artist, or not even just a makeup artist. If you have problems with under eye wrinkles, is that what it's called?
Yeah.
Definitely get it because it's light changing. It makes everything baby but smooth.
Yeah, and it's just her pictures were just so flawless. She didn't have to do touching up or any of that. It just naturally was just popping.
I can't wait to get it done today. You guys will see it. Next question is, at what age should someone start doing Botox and does it hurt?
Okay, so at about age 30 is when our collagen production and the elasticity of our skin really starts to change. So a lot of people wait to 30, but nowadays with just all of our access to all of these procedures, people are even starting in their early 20s because they're not wanting to change their face. They're just wanting to basically prevent the aging process from setting in at an early age.
Yeah, so the next question I have is from me, and I want to know why non-surgical procedures are so popular right now. It's like trending like crazy.
I know, it's really amazing. I mean, I've been in the industry for 11 years and I've never seen so much like openness and people posting about their procedures and people like willing to talk about it. I think it's so awesome. It's like an age of awareness where, you know, Isabel, she looks flawless and she is flawless, but she's doing little things to perfect her face, and instead of not telling you guys and being like, this is me, I'm flawless, she's coming out and telling you guys, look, I did this, I did this, I did this. I think that's really brave, and it's really awesome because now you know how she can achieve certain looks that, you know, maybe she wouldn't be able to without these procedures. Hey everyone, we're here today with Isabel. Some of you may know her from Instagram. She is an amazing makeup artist, and today we're going to be doing some procedures on her, and we wanted to invite you in to watch all the behind the scenes of everything that we're going to be doing. We hope you guys enjoy it. We're going to be applying Botox to her forehead just to give her that flawlessly smooth forehead. Beautiful. And these bumps will go down in about 10 to 15 minutes. We're injecting a little Botox around her eyes to just help with any fine lines that start to develop around the eye. We don't like those. We need flawless face. Here we're injecting a little bit of Botox in the chin to help with chin dimpling. Injecting a little bit of Botox directly under the eyebrow for an eyebrow lift. This is called a chemical brow lift.
Go. Today we're going to be doing a non-surgical nose augmentation on Isabel to correct her ratchet nose and this grotesque bump that lingers right in the middle, right here, that one, this one, nasty. The first step in this procedure is to apply a local anesthetic numbing medication to anesthetize the area so that she doesn't feel any discomfort while we're injecting the dermal filler. Now we'll be injecting the Juvederm Voluma. This will help reshape her nose. We blend the voluma above and below the bump to hide it or disguise it. There, any pain you're feeling is just revenge for breaking all those hearts online.
Let's try. We're adding a bit of numbing to make this procedure pain-free. We're doing a lip augmentation with dermal filler to create a more plump, pouty look. Any pain?
No.
Here we're treating her under eyes with Voluma. This is going to help minimize hollowness, and also it's going to help with the under eye darkness that she's experiencing. Ooh, easy there, killer. Gotta tap the bone. Gotta tap it. If I don't, you're floating in space. One more here. Hey everyone, we just finished her procedures and everything went super well. We're so excited to show you guys these before and afters. Like, it's literally gonna blow your mind. So stay tuned and follow us on Snapchat, Cali Cosmetics, and our Instagram, California_cosmetics, for before and after photos that will be posted in about 2 to 3 weeks. Thanks guys, see you soon.